hopefully you immediately recognize this rhythm as a dangerous heart rhythm. It is very fast. Over here, what looks to be like a QRS complex is relatively narrow, but over here it's wide. And remembering that wide complex tachycardia is ventricular tachycardia unless proven otherwise, ought to put you on the right track with this tracing. Now, a lot of times people will look at this and say that this is torsades, and there is variation in the amplitude of these deflections over here. However, it's important to remember that torsades is a subtype of ventricular tachycardia. It is polymorphic ventricular tachycardia. This is going too fast to really be organized ventricular activity like a VTAC would be. Looking at the big box method with this, it's going over 300 beats per minute. So the heart's not actually beating at that point, it is quivering, it is fibrillating. This is ventricular fibrillation. And coarse VFib, as it's sometimes referred to, can have varying amplitude activity like this. Now in this case, it does look like maybe over here, this could be ventricular tachycardia. It's going a little bit slower. It looks, a little bit more like VTAC. But in a patient who has got a sick heart from heart failure or an MI or whatever it is, it would not at all be unheard of to actually capture on an ECG ventricular tachycardia devolving into VFib. And so I think that's what we're seeing here. As a result of that, we don't really have anything else to say in terms of axis interval blocks, etc. This is ventricular tachycardia, ventricular fibrillation that requires immediate cardioversion.